My name is Hilda. I'm an accredited practicing dietitian located in Victoria. And I would like to welcome you to today's webinar, Dairy Myth Busted by a Dietitian. Thank you again for joining in today, and thank you for submitting your myth. We received an overwhelming number of myths to bust on the topic of dairy and milk, which we couldn't cover in today's webinar, but we are going to release few articles on our website. So please stay tuned for more information. And let's dive in and talk about dairy and debunk some of the myths. The first myth that we're going to discuss says that it is unhealthy to drink cow's milk as it contains pus, blood, and bacteria. And this myth is false. Cow's milk is the biggest contributor of calcium in the Australian diet and provides a range of nutrients for good health. However, milk from infected cows may contain pus, blood, and bacteria that can cause illnesses such as gastroenteritis or listeriosis. But since 1940s, it's been compulsory in Australia to pasteurize milk, and selling raw milk has been considered illegal. Pasteurization or pasteurized milk means that the milk has been heated for 15 seconds to a temperature of 72 degrees, and that temperature is able to kill all the microbes that are responsible for diseases. And despite the high heat, all the nutrients are not affected, which is great. So we get rid of all the microbes, but we get all the calcium and the nutrients that we need from the milk. Next myth says that low-fat milk is better than full cream milk. And this myth is false. So all type of dairy milk, from regular to low-fat to skimmed milk, are part of the 5 food groups, and they are recommended every day for good health. However, an important reason why you should consume milk and dairy products carefully is because dairy products contain saturated fats, which increase cholesterol level and increase the risk of heart diseases. That's why adults are advised to consume low-fat milk instead of full cream milk to reduce the risk of heart diseases. What about calcium content in these types of milk? Interestingly, low-fat milk has more calcium than full cream milk because when the fat is taken out of the milk, the calcium increases proportionately, which is great for people who drink low-fat milk. On to our next myth that says that for best health, we should all drink full cream milk at every age. And this myth is false. So all types of cow's milk, from full cream to skimmed, are rich in essential nutrients, including bone-building calcium and protein. So you can choose the right milk for your age and for the health status. And let's talk about each age group. Babies should be breastfed or formula-fed until the age of 12 months. And after that, toddlers age 1 to 2 should have full cream milk to support their growth and development. Now, adults, on the other hand, because there is a higher risk of heart issues from the saturated fat, the recommendation says to have the low-fat milk. And elderly, lastly, they are recommended to have the full cream milk because this population is at high risk of malnutrition and require high energy and protein intake. Next myth that we have says that yogurt is good to eat when you're on antibiotics. And this myth is true. What are antibiotics? So what do? They kill the bad bacteria, which cause illness in the body, but they would also kill the good bacteria in the gut. And the idea from having probiotics is that it restore and replenish the intestinal flora and the good bacteria in the gut. We have food like miso, like fermented vegetables, kimchi, sauerkraut, kombucha. They contain a lot of probiotics, which help to restore the good bacteria in the gut. Now, similarly, yogurt and kefir, they also contain probiotics, but they contain calcium. So the problem with taking antibiotics and dairy products at the same time is the calcium, because calcium binds to antibiotics and it prevents the antibiotics from being absorbed to the body. So that doesn't mean that we can't have probiotics or yogurt and kefir while having the antibiotics, but it means that we need to spare some time. Around 2 hours is recommended after we take the antibiotics, and 6 hours before we take the next course. And this should be okay. The next myth says that lactose intolerance is for life. And this myth is false. What is lactose intolerance? Lactose intolerance means that your body cannot digest lactose, which is a sugar in the milk, because there is insufficiency of the lactase enzyme. And this may result in some symptoms such as bloating, diarrhea, some stomach upsets after the ingestion of milk and dairy products. In some cases, lactose intolerance may result from gastroenteritis, and lactose intolerance would be only temporary. It would last 4 days or 4 weeks. In other cases, lactose intolerance may be long-term, and it may last for months or for years. So it is always important to retest the tolerance, because we can often build up the tolerance level for lactose, and it's important to consult with the dietitian while we are rebuilding the tolerance and testing the lactose intolerance. The next myth that we have is you can't have any dairy food if you are lactose intolerant. And this myth is false. Good news for people with lactose intolerance. Let's talk about each type of milk and dairy, about dairy products. Starting with hard cheeses, they contain no lactose, and they are often well tolerated for people with lactose intolerance. Butter and cream contain very low amount of lactose and are usually well tolerated. So is fresh cheeses such as cottage and ricotta cheese. They have very low amount of lactose, and they are often very well tolerated. Yogurt, on the other hand, has low amount of lactose, and it is well tolerated for people who have lactose intolerance. And interestingly, the bacteria in the yogurt consumes the lactose as a source of energy. So day after day, the content of lactose in the yogurt will be lower and lower. What about milk? Now, people with lactose intolerance can consume around 240 mils of milk per day, but you need to work out your own tolerance level. And you can always go for lactose-free options or lactose-free milk, which means that the sugar in the milk has been broken down by lactase. And a tip from a dietitian would be to have full-fat milk, as the fat in the milk slows the journey of lactose and gives more time for the lactase to digest the lactose. And always remember that what works for you will depend on the amount of the lactase that your body secretes or produces, and the type of intestinal bacteria that you have, and the product itself. So it is a trial and error process, and you need to find the right approach for yourself. And on the side, there's a medication that would help. It's called Lactase, and it's off the counter, and it contains the lactase enzyme. So you just need to have it whenever you're going to have a lactose-containing product. It assists with the digestion of lactose, and it provides effective relief of wind, of bloating, digestive discomfort that's associated with lactose intolerance. And it's also good to involve a dietitian before trialing this medication to see if it is suitable for you, of course. Now, the next myth that we have says that avoiding dairy if you have eczema. And this myth is false. What is eczema? Eczema is a chronic inflammatory skin condition. It's characterized by dry skin that may have red, intensely itchy patches. Common triggers for eczema include the hot weather, fabrics, deodorants, food allergens, dust, and microbes. And to understand the relationship between eczema and the diet, it's good to understand the difference between food intolerance, and food allergy. Food intolerance means that your body cannot tolerate certain types of food, and this may result with bloating, with diarrhea, with some stomach upsets, and there is minimal evidence that suggests that lactose intolerance may trigger eczema reaction. Food allergy, on the other hand, provokes an immune reaction. It may appear within 30 minutes of ingestion of certain food. And the reaction would be like some irritability, vomiting, itchy skin. This would be a food allergy reaction. And food allergy is more common in infants with eczema, and when they have a family history of allergy. There is some evidence that suggests that managing eczema at a younger age may reduce the risk of developing food allergy. And when a child has eczema and food allergy may trigger eczema, but it's not the main reason for eczema. So in summary, dairy does not need to be avoided if you have eczema. However, if someone has cow's milk allergy, there may be a particular trigger for person's eczema. You need to work out the tolerance and whether you need to avoid the milk with the doctor and consult with the dietitian for dietary advice. And as everyone's different, people would have different triggers. So it's not always the milk or the dairy product that would trigger the reaction. It could be another allergen in the food. Next myth, children allergic to milk, protein, and egg can't have enough protein. And this myth is false. Milk and egg allergies are the most prevalent in infants and young children. But good news is that most children outgrow these two allergies. Omitting eggs and milk in the diet may result in nutrition deficiencies, and particularly proteins. Proteins is essential for physical growth and brain development of kids. Let's talk about cow's milk and eggs. So cow's milk is an important source of energy, protein, calcium in the diet, especially for developing infants and children. So we need to have an appropriate substitution for milk. And milks like rice, oat milk, and nut-based milk are not recommended for young children because they have very low amounts of calcium, of fat, and of protein. Eggs, on the other hand, they are a perfect source of protein, and they contain a wide variety of nutrients such as antioxidants, omega-3 fatty acids, vitamin A, D, E, B12, and choline. So when the child has milk and egg allergy, parents need to ensure that they increase the intake, the prevalence of protein in the diet from other sources. Other sources of protein include meat, poultry, fish and seafood, tree nuts, seeds, tofu, lentils, and legumes. So as long as the diet is rich with these sources, it shouldn't be a problem. Next myth, consuming dairy after 3 p.m. is bad for you. And this myth is false. So there is no research that suggests that consuming milk at a specific time during the day will increase the health benefit of the milk and dairy products. However, some people find that consuming or drinking a warm glass of milk will promote better sleep. And in fact, milk and dairy products, they do promote good quality of sleep, and they have positive effect on the physical and the mental health. Why is that? So the reason why the milk has some properties with sleeping is because of an amino acid called tryptophan. Tryptophan plays an important role in the secretion of two things, of serotonin and melatonin. So serotonin is a neurotransmitter that impacts mood, cognitive reasoning, and memory. Melatonin, on the other hand, is a hormone released by your body in response to darkness, and that help you to sleep at night. So if you do struggle to sleep, a warm glass of milk would be helpful. Next myth that we have, low-fat milk has more sugar in it. And this myth is technically true, only slight difference. So as you can see in this table, the sugar content is slightly higher in the reduced fat milk compared to the full cream milk. And the main difference between these two types of milk would be the saturated fat content. And as saturated fat increases the cholesterol level, the benefits of reduced milk or skimmed milk still outweigh those of full cream milk, even with the difference in the sugar content. Now, the next myth that we have says that dairy is the only source of dietary calcium, and this myth is false. So, milk and dairy products are the main contributor of calcium in the Australian diet. However, they're not the only sources of calcium. Calcium is also abundant in calcium-fortified food, in some soy, in tofu, in salmon, in sardines, and to a lesser degree in some green leafy vegetables and nuts and seeds. Grains, on the other hand, they do not provide a great amount of calcium, but because they're very abundant in the diet, they are considered as contributor to the calcium, which is great. And the next myth that we have says that drinking milk changes the alkalinity of the body and leaches calcium out of the bones. This myth is false, as there is no scientific evidence that suggests that milk would influence the pH of the body. However, in fact, excess protein in our diet causes calcium to leach out of the bones, which can be a cause of osteoporosis. Cow's milk contains a lot of proteins, usually needed by the calf, more than humans, and it's considered unhealthy for humans. Remember how it's compulsory in Australia to treat the milk before you drink it? Two types of treatments are used for milk. There is the ultra-high heat treatment, and there is the pasteurization. Pasteurization would denature around 10% of the proteins, while ultra-high temperature treatment will denature around 70% of the protein, which means that there is less protein from the cow's milk. And protein is not only available in milk and dairy products, it's also abundant in many other foods, such as meat, poultry, fish, eggs, tofu, nuts and seeds, legumes and beans. So it's not only important to limit the amount of protein from the milk and dairy product. It's also important to stick to the Australian guideline, which suggests 1 to 3 serves of the protein per day. Each serve of protein or each serve of meat would be around 60 grams of cooked meat, around 80 grams of cooked chicken, 100 grams of cooked fish, around 1 cup of lentils and legumes, and around 30 grams of nuts and seeds. The next myth that we have is that a full-fat milk powder is better than skimmed milk powder. This myth is false and true. Actually, it depends on the age and the health status. So skimmed milk or 1% milk contains all the proteins, the vitamins, and minerals similar to the whole milk, but the main difference is the amount of saturated fat. And saturated fat increases cholesterol, so it is recommended for adults to consume low-fat milk. On the other hand, full cream milk contains more energy and fat, which is required by 2 age groups, children, because they are developing their bodies and growing, and elderly, because they are at a high risk of malnutrition, and they often have low appetite and oral intake. On to our next myth. Cheese contains the most lactose out of any dairy product. And this myth is false. Good news for people with lactose intolerance. Excuse me. But cheese contains minimal lactose compared to milk, yogurt, and cream. Sorry, one second. So in fact, cheese contains minimal lactose if we compare it to milk, yogurt, and cream. And that's because during the cheese making process, when the curd is removed from the whey, there's a lot of there is a lot of lactose that's removed because the whey is very abundant in the lactose. And according to the Australian dietary guidelines, people with lactose intolerance can generally eat cheese, as most of the types of cheese are very low in lactose. And as you can see in this table, the lactose content is the highest in regular milk and yogurt and is the lowest in hard cheeses such as Parmesan, cheddar cheese, Swiss cheese, and camembert. Excuse me. On to our next myth. You can only eat certain types of cheese when you are pregnant. And this myth is true. Pregnant women are more susceptible and more severely affected by infectious diseases. So if you are pregnant, you need to avoid unpasteurized milk, soft serve, and soft cheeses such as ricotta, feta, mozzarella, bocconcini, and blue vein cheese. Because they contain listeria bacteria, and listeria may cause listeriosis, which is an illness. And if the baby becomes infected with this bacteria, that may result in preterm birth, in stillbirth, and miscarriage. So what you need to avoid, to avoid listeriosis is to drink pasteurized milk and consume all the product from pasteurized milk. You need to eat hard cheeses instead of soft cheeses. And hard cheeses, by their nature, they're more acidic, so it would be less likely to grow any bacteria. And the last recommendation is to eat the packaged ice cream instead of the soft serve. The next myth that we have says that breast milk and breastfeeding contains so many nutrients. And this myth is absolutely true. Breast milk is actually considered the ideal food for infants. It contains all the nutrients and factors that your baby needs. It is safe, it's clean, it contains antibodies to fight the infection and the inflammation, and it increases the immunity of the baby. And let's talk about each element in the breast milk. Firstly, we have the immunity. So as we mentioned earlier, breast milk contains antibodies to fight the infections and the inflammation. In terms of sugar, breast milk contains oligosaccharide, which is a complex carbohydrate. It acts like prebiotics, and it is like food for the good bacteria in the gut. It feeds the bacteria, in another word. In terms of protein, breast milk is abundant with proteins, which support the child's development and growth. In terms of fatty acids, breast milk contains long-chain fatty acid, which support the growth and development, and mainly the development of the nervous system and the brain. And in terms of vitamins and minerals, breast milk contains a lot of vitamins and minerals, which support the health and development of the baby, and it supports the development of teeth and the growth of the bones. But one thing that I want to flag, speaking about the breast milk, is the maternal diet is not always optimal. So sometimes the level of nutrients will vary from one woman to another. And that's why supplementation during breastfeeding is sometimes important to ensure that the baby receives all the nutrients and the vitamins that are required. And the last myth that we have says that having dairy as a breastfeeding mom can cause tummy cramps in baby. This myth is false because babies can be unsettled for many reasons. It may be something other than food. So before changing the diet, see if the baby is unsettled because of a medical condition such as reflux, or some newborn behavior such as fussiness or cluster feeding, or it could be some low supply of milk or oversupply of milk. Lactose intolerance is something that's poorly understood in the Australian community. And there is some myth circulating around. And despite what it says that removing dairy products and milk from the diet will decrease the amount of lactose in the milk, this myth is totally incorrect. The diet does not affect the amount of lactose in the breast milk because lactose is the main sugar of the milk. On the other hand, if you like to prevent any cramps or any or prevent the baby from being unsettled, there are some food that you may find triggering for these symptoms, such as beans, broccoli, cauliflower, and some dairy products. And there are some foods such as cow's milk, eggs and nuts, peanuts, fish, and shellfish. They are common allergy causing food. So if you find that the baby has a reaction to food, consult with the doctor before avoiding these foods and drinks. And lastly, with all the myths that are circling around, dietitians are the experts, and they are a reliable source of evidence-based nutrition. So always reach out to dietitian for support. And at Oscar Care Group, we have 18 amazing dietitians that can support you in different facilities. In HK, we do provide one-on-one with residents. We do provide menu developments, education sessions, malnutrition screening, supplement reviews, and we can also support you in childcare. We provide nutrition training, menu development, and food allergy training. And within our Mulgrave Clinic, the dietitians are able to help with one-on-one consultations for a range of reasons, including cholesterol, weight management, IBS, celiac disease, diabetes management, and many, many others. Our team is here to help everyone for all ages and can even conduct a telehealth assessment if you are unable to come to the clinic. So we're here to help you. You just need to reach out. And before we end this webinar, I would just like to mention that our next webinar will take place on the 20th of October at 11:30. And you wouldn't want to miss this webinar because it is the last webinar within the Food Myth series. So it's really interesting topic. So do RSVP via our website. And I would like to thank you all for joining. Thank you for submitting your suggestions. We hope that you found that everything was interesting. And if we didn't cover your myth today, don't worry. We have some webinars coming up to cover all the amazing suggestions. And this webinar has been recorded and will be available to rewatch on our website later this week. So thank you so much and bye.